one of the nice elements about having a conference that involves colleagues from all other disciplines is not only that we tackle the subjects that are pertinent to medical oncologists, but also integrate the whole multidisciplinary team into discussions that pertain to our patients across, the spectrum of GI malignancies. GI malignancies have become quite complex, and the role of medical oncologists is pretty central to these discussions. When we take, for instance, HCC with hepatocellular carcinoma, we were a secondary thought about 10, 15 years ago. Today, we're pretty central. We're treating patients in the more advanced setting, bringing many of them to local regional therapies, and even for some patients being able to bring them to transplantation. So things have become much more complex, even for the medical oncologists, as we try to navigate, the complexities of the different diseases we treat. Take, for instance, the plenary session at ASCO looking at the value of radiation with chemotherapy versus just chemotherapy, both followed by surgery. And it appears that for most patients, we probably would not need any more radiation in gastroesophageal cancers in the early stages. Of course, that discussion is important to have with our radiation oncology colleagues, because I still think there are maybe some patients who may benefit from radiation. Let's say, the elderly patient who's frail, perhaps would not be able to go through FLOT, then chemo-rad may be an option. Also, understanding where immune therapy plays a role. So I think it's so important today, at least in the earlier stages of the disease, but even for some patients in the later stages of the disease, to have the multidisciplinary team involved in the discussions at all points, for patients in order to optimize their likelihood of surviving their cancer.